Let's go through the BRAIN acronym. So the BRAIN acronym is a really useful tool for making informed decisions during your labour and the birth of your baby. It helps you and those supporting you during labour evaluate your options and consider all aspects of any proposed interventions or decisions that need to be made. So here's what BRAIN stands for and how to use it. So whenever you're in a situation during your pregnancy or during labour where you're asked to make a decision, I want you to use your brain. So the first thing you're going to ask are, what are the benefits? So ask about the positive outcomes of the proposed intervention or decision. This is going to help you understand how it's going to help you and help your baby. Next, I want you to ask about the risks. So inquire about the potential risks or any side effects. So consider how these might impact you or your baby. Then you're going to ask, what are the alternatives? So this gives you the option to explore other options or other methods. And sometimes there are less invasive or different approaches that could be considered. Next, I want you to use your intuition. So what is your intuition telling you? Listen to your gut feelings or your instincts. Your emotional and intuitive response can provide really valuable insight into what feels right for you. Next is to do nothing. So what happens if you just do nothing? So consider the consequences of not taking any action at all. So that might be right now, or it might be that you're not going to take any action for a couple of hours. So this is going to help you understand the potential outcomes if you choose to wait or do nothing at the moment. So let's look at how to apply and use BRAIN. So let's look at during your prenatal appointments. So you're going to use BRAIN when discussing your birth plan with your healthcare provider. It's going to help you make informed decisions about things like pain relief, labour positions you might want to use, and other aspects of your birth plan. You're going to use it in labour. So perhaps when a medical intervention is suggested, you're going to use the BRAIN questions to evaluate whether it's the best option for you and your baby at that moment. And you can use it in post-birth decisions. So after delivery, use BRAIN to make decisions about newborn care, such as vaccinations, feeding options, or treatments if your baby requires medical attention. So let's go through an example, a real life example of how to use BRAIN. So if your healthcare provider suggests inducing labour, so I think it's time that we thought about inducing labour and getting this baby out of you. You're going to use BRAIN and you might ask the following questions. What are the benefits of inducing labour now? What are the risks or the side effects of this induction if we have it now? Are there any alternatives to inductions, such as waiting longer or trying natural methods to try and bring on labour? How do you feel about induction? Does it feel like it's the right choice for you? What's your intuition telling you? What happens if you decide to wait and not induce labour now and just do nothing? So using this BRAIN acronym is going to help you take an active role in your childbirth experience and ensure that your decisions are well informed and aligned with your preferences and values.